Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. We will be discussing the cover test in case of the ophthalmology. So first, there are various tests. First will be the cover uncover test. So what is the cover uncover test? So this is basically to detect the presence of the heterophoria. That is the latent squint. And one eye is covered with the occluder and the other eye is made to fix with an object. So one eye is the occluder, other eye you fix it with an object. Next is in presence of the heterophoria. So in presence of heterophoria, so in presence of heterophoria, what is happening is that the eye under the cover deviates. So the covered eye, it deviates. Next is when the cover is removed, the under the cover will return back to normal. So the covered eye, it becomes normal. So heterophoria, when there is a cover, it deviates, and when the cover is removed, covered eye is removed, the cover will return back to normal. So this is when the removal. Next we move on where this movement is observed and the direction of the movement determines the type of heterophoria. So the direction, based on the direction you understand what type of heterophobia it is. So in case the deviation under the cover, it takes place towards the eye, it's known as the esotropia. So towards the medial aspect will be the esotropia. When it is under cover and the eye movement is towards the nasal side, that is esotropia. Esophoria. And once the cover is removed, it again moves back to normal. So in case of exophoria, when you put the cover, the eye, it deviates towards the lateral side. So towards lateral side, so this means it is exophoria. So this was about the cover uncover test. Next we look at the direct cover test. So what is meant by the direct cover test? So direct cover test, it is used to confirm the presence of the manifest squint. So it is used to confirm the presence of the manifest squint, and it differentiates between the apparent squint from a manifest squint. So it is used to differentiate the apparent squint. And then the patient is asked to fixate at a point light. So the patient fixes at the point light, and after that the normal looking eye is covered. So you fixate on a point light, the normal looking eye is covered. So then you cover it, and after covering in manifest squint, the uncovered eye will move in the opposite direction to take the fixation. So in case of the manifest squint, it will move towards the eye will move. The uncovered eye. The uncovered eye will move in the opposite direction, will move opposite direction. So we are talking about the uncovered eye which is moving in the opposite direction to take fixation. Next is in case of the apparent squint. So in terms of apparent squint, there will be no movement of the uncovered eye. So in apparent squint, there is no movement. So it's easy to remember because apparent A usually stands for no. So in apparent squint, there is no movement of the uncovered eye. No movement. Now we saw about the cover uncover test. Next we saw about the direct cover test. Lastly we'll be looking at the alternate cover test. So what is meant by the alternate cover test? So here the patient has, so for example, the patient having a right exotropia with the left eye fixating. So in a patient, let's look at an example where a patient has a right exotropia. So right exotropia with the left fixating eye. So in such case, both the eyes move each time they cover, alternate from one eye to another. So here what we see is both eye, it moves. It moves each time the cover alternates from one eye to the other. So alternates the cover. Then it reveals if the squint is unilateral or alternate. So this will basically indicate in case it is unilateral or alternate. And it differentiates between the concomitant and the paralytic squint. And the paralytic squint. To learn and grow daily like this, please do subscribe.